those individuals having low back pain. But my topic is inflammatory low back pain. Inflammatory low back pain is approximately 5 to 6% in the US adults, and in the UK it is approximately 3 to 7%. However, the prevalence of SPA is lower, that is spondyloarthritis is lower in the USA. Asian prevalence is very low. It's around 0.001%, 0.001%. There are several features. Those has been proposed for the definition of inflammatory low back pain by inflammatory back pain. These are age of onset less than 40, insidious in onset, improvement with exercise, and no improvement with rest. Pain at night with improvement upon arising from the bed. Gradually it disappears. So these are some of the important points which characterizes the inflammatory low back pain. This was published by this was the survey type of things was done in the patients by expert rheumatologists. Two questions were asked: whether the pain is inflammatory, whether the pain is non-inflammatory, and these are the criteria that has been came out. The age, the back pain, insidious onset, morning stiffness, improvement with exercise, and no improvement with rest. Alternating buttock pain is also one of the important features that came out at that survey, and pain at the night time. So inflammatory back pain is a chronic pain localized to the axial spine and sacroiliac joints and differentiated from mechanical back pain by those sets of criteria that I have been described already. So if a patient or a group of patients with inflammatory back pain, if we follow them for quite a longer period of time, what happens to those patients? You see, this was a study published in 2018, Arthritis Rheumatology. There are 3 sets of happenings among them. The spondyloarthritis group, this is the spondyloarthritis, that is ultimately these patients develop the definitive diagnosis of spondyloarthritis. Spondyloarthritis, what is spondyloarthritis? You all know spondyloarthritis is a group of heterogeneous group of disorders, but যাদের কতগুলো কমন ফিচার্স থাকে এগুলোকে স্পন্ডাইলাইট। এটা আমার মনে হয় যে এখানে সবাই রিমাটোলজিতে ইন্টারেস্ট, those you all know all these things. And there is a group of patients, individuals, those they have just the pain spontaneously resolved over the course of time. The number among them is, you see, 39 progress to spondyloarthritis among these 124, and 15 developed non-spondyloarthritis. Non-spondyloarthritis means they don't develop the spondyloarthritis, but there are other problems. And 58, the bulk, the majority of them had resolved spontaneously over the course of time with NSAID. So inflammatory back pain is not synonymous with spondyloarthritis. This is very important. The back pain, inflammatory back pain, and spondyloarthritis. So if any patient comes to us for this low back pain, we have to have resolved whether this is mechanical or inflammatory low back pain. So we need to take a very good history. So history is very important. Physical exam next, and then lab investigations. So we have to take history and also exam related to these features. What are these? Impaired spinal mobility, postural abnormality, buttock pain, hip pain, peripheral arthritis, and enthesitis, and in some cases dactylitis. But there are some other features. The family history. Family history is very important. Family history of spondyloarthritis, and there are some other extra-articular manifestations that I will describe later on. During this evaluation, impaired spinal mobility, the structural abnormalities of the vertebrae are much more severe in advanced. So, whenever we are evaluating a patient of inflammatory back pain, if there is any spinal mobility problem, then it has to be ascertained that the disease is for a very longer period of time. If there is no much spinal mobility problem, then it may not be very advanced disease. You see the postural changes. This is also again, this is the traditional book picture of ankylosing spondylitis. If we can diagnose this ankylosing spondylitis or axial spondyloarthropathy at this stage of the disease, then it's very fruitful of treating that patient. If otherwise, it's not very useful to treat this patient. So postural abnormality is very important. Buttock pain, especially the alternating between the two sides of the buttock, and sometimes maybe bilateral, maybe unilateral. It usually indicates the involvement of SI joint. The hip involvement is present, hip joint involvement. This hip joint involvement is usually present in 20 to 25% of patients with ankylosing spondylitis and 10% of patients with non-radiographic axial spondyloarthritis. The peripheral arthritis. Whenever any inflammatory back pain, it may be associated with peripheral arthritis. We usually say that in a young male involving the lower limb joints, post-articular involvement, it could be a case of spondyloarthritis. This is usual teaching, this is usual learning. So you have to look for the involvement of peripheral arthritis, especially the large joints of lower limbs. Enthesitis, this is one of the important musculoskeletal involvement. The picture here, this is the swelling in the site where the Achilles tendon has been inserted into the calcaneus. So this is the inflammation of this site, is known as enthesitis. This is very important. Enthesitis is it may be Achilles heel enthesitis, it may be plantar fasciitis, it may be only heel pain, and it may be pain in the chest, pain in the iliac crest. So all may be a feature of enthesitis. Dactylitis. Dactylitis is also very important characteristic feature we should look for in any case of inflammatory. This is sausage disease. In other words, it's being called sausage disease. But other than these spondyloarthritis, the psoriatic arthritis, there are other causes of sausage disease. It may be tuberculosis of the small joints, it may be syphilis, it may be due to sarcoidosis, sickle cell disease.